Welcome back. If you've been to a public clinic or a hospital lately, you've probably noticed how few nurses there are to attend to a very large number of people. Well, it might surprise you, it's not just a South African problem, even though we think it is. According to a World Health Organization report, every country should be training a lot more nurses than they do each year to avoid a crisis, a potential catastrophic global shortfall of over 10 million nurses by the year 2030. Dr. Sharon Vasuthevan joining us now on the show. Good morning, Doctor. Good to have you with us. We'll zone in on South Africa in just a moment, if that's okay. Just take us through your reaction to this report, a global catastrophe in less than 10 years from now. How did we get to this point? Good morning.
Good morning, Gareth, and good morning to your viewers. I think this has been coming for a long time. And, I'm glad that we're having more conversations on the topic more recently. South Africa's had a shortage of nurses for a long time, long before the pandemic. Our recent study done between the National Department of Health and the Hospital Association of South Africa actually reveal that we have a current shortage of anything between 26,000 and 62,000 nurses, and predominantly registered nurses, which is the core of our nursing profession. So, and they estimate that we could have a shortage of anything between 131,000 to 160,000 by the year 2030. And that includes the attrition we're going to see due to the retirement of a number of nurses.
And I see if we even come back 5 years earlier than that, Doctor, I'm seeing a report here from the Human Resources for Health Strategy, a report coming out from them that by the year 2025, our own country, we could face a shortage of 34,000 registered nurses as well. And that's only about 3 years away. Is it too late to try and fix this? Is there something we can change as a country? What does the Minister of Health, for example, have to do about this?
So, Gareth, I think that there's a number of things we could do. And, and there's a number of stakeholders involved. So in the last few years, we have seen, a change in the nursing qualifications. And that we know every time we've changed qualifications as a country, we've seen a reduction in the number of nurses that are produced only because of the process. Your initial cohort of nurses that you take on a new qualification is usually smaller. So you have smaller throughput rates and outputs from our nursing education institution. We've also moved nursing into the higher education ban. And while that is a great aspirational goal for us as a profession, it comes with its own challenges, because now as providers of nursing education, we're subjected to the bureaucracy of a number of authorities, and going through all of those hoops in order to get your accreditation creates much delays in terms of actually getting your programs up and running. And, we're also seeing that if you just look at the state of some of our public health facilities, we have a shortage of clinical facilities. So, nursing is the training of nurses includes both the theory and the practice, and the practice is critical. So, while the private sector really has great facilities, state-of-the-art clinical facilities, some of our challenges rest with community facilities and midwifery facilities. So we need to be training more people that could serve our communities. We need more midwives. We can see the highest litigation comes from maternity. And so my approach to this is that this is a crisis. I think about 2 years ago when I was on your program, I said this is a tsunami. And I believe that the stakeholders need to come together around the table and say, what are we going to do to fast track the number of nurses that we are currently training?
And
That's
exactly the question I think so many people are asking, because it's a fast tracking right now. Doctor, 2025, almost 35,000 nurses. We're not going to have enough of them. And you started our conversation by saying how bad it's going to be. A catastrophe is the right word. By the year 2030, close to over 100,000 shortage of nurses. Dr. Sharon Vasuthevan, thank you for your time. I think you've given us a lot to think about and pick up with as far as what needs to be done, whether it's the red tape, the administration, the lack of money in the public sector. These aren't easy questions to answer, but at least we have to have the conversation before we hit the catastrophe.